Hello, everyone. Welcome to another episode of Dr. Plano's Plastic Perspectives. Today's date is December 20th, and I'm Dr. Jeff Angobaldo, a board certified plastic surgeon known as Dr. Plano. Our plastic perspective today will be focused on breast augmentation, otherwise known as breast implants. What are the benefits of breast implants? We see patients from all different age groups, and it's all about confidence. And if someone genetically has a small breast, like a small A or a small B, it gives people a lot of confidence when they fill that volume with an implant. There are two types of breast implants, saline and silicone. And what are the benefits of breast augmentation or breast implant surgery? Patients have increased volume, fullness. It really, especially after pregnancy and breastfeeding, a lot of people will atrophy, especially the superior pole of the breast. So having breast implants kind of restores that breast shape after weight loss or breastfeeding and gives people back their volume. They also have improved proportions. Some people feel for their body type, their breasts are too small. And so it really restores a lot of confidence having an implant. Every 10 years, a new generation of implants come out. And they're really, every generation, they become more durable and more long lasting. And for every patient, these implants now, there's different variations. So it comes in different shapes, some different sizes. We talked the different types of materials. Like, for example, we talked about saline and silicone, but there's actually different grades of how cohesive the silicone implant is. For example, we use natural implants, and they're called a soft touch, is one type of implant, and they feel softer. And all silicone compared to saline feels more like breast tissue. That's why we kind of, as plastic surgeons, always favor silicone. So as we discussed, the soft touch feels more natural, but the silicone is less cohesive. And as you move up, the highly cohesive implants, they feel a little more firmer. So why do we choose one over the other? If someone's very thin, you can actually see a little bit of the rippling of the implants. And so for those patients with small breasts and thin tissue, I think the best option would be a more cohesive implant that really hides the ripples. That's the reason why we place implants below the muscle. So it's the majority of the time for all patients, our number one plane to place implants are below the muscle versus above. And so, especially when someone's thin, that extra muscle gives you an extra centimeter of padding. So there's less risk of rippling. There's less risk of rippling with silicone compared to saline also. There's also different types of implants. We talked about the cohesiveness of the silicone, but on top of that, the shape is different. Some that want more cleavage and more of a natural result choose more of the moderate profile implants, which has less projection and it's wider. And with some folks that want a more projecting implant that gives them more volume superiorly, they'll choose the high profile, full profile implants. It gives them more projection. But there's also less cleavage. So if someone has a wide gap and wants to look natural, I always recommend the moderate implants because there's less projection and it's wider. If someone wants that, hey, I have implants, I want that kind of like that circular look, we use the highest profile implant for those particular subgroup of patients. These implants, they say last a long time. And in our studies, about 40% of patients get a new implant within 10 years. From our patients, they want to go bigger or smaller within that time frame. But if they move and there's no issues, they can last a lot longer than 10 years. There are complications. When an implant gets hard and gets a little stiff over time, it's called a capsular contracture. putting the implant below the muscle gives a little more protection with capsular contractures. There's actually a warranty on these implants for, at least with this one particular kind that we use, Natural, it's 2 years. So if an implant gets hard or encapsulates, the treatments remove the capsule and replace the implants. Because like this generation of implants, like every 10 years, a different type of implant comes out that changes just a little bit, but it's meant to last for a longer period of time. And with this last generation of implants, they're very durable. I've seen like TikToks and Instagram where like cars run over the implant and it still doesn't pop. Now, I tried that with my Tesla, which weighs 6,000 pounds, and it did rupture. But so I don't know. I guess don't believe everything you see on social media, TikToks. But yeah, I mean, but they're super durable. We've had some of our employees for like a social media reel or a TikTok throw them from the parking lot area, which is a few stories high, and I mean they don't break, and so they've maintained its shape. So it's amazing how like this last generation of implants they're very durable, but there's a 10-year warranty for ruptures, which is very difficult to diagnose on an examination or an X-ray. So the FDA recommends maybe doing an MRI every 3 to 5 years to see if there's actually a rupture. And because it's a very cohesive implant, all the gel stays inside the implant shell. For example, if I poke a hole in the implant and I squeeze out the gel and it comes out with pressure, I release my pressure, it goes right back into the implant, into the gel. It's a very cohesive gel. It's amazing, like the technology. So like if I cut it in half and hold each half, it stays within their respective halves. That's why it's very difficult to actually diagnose a rupture, because if there was a break in the implant shell, all that implant material, the silicone gel, is inside. And if with the MRI, it's so detailed, you can see like a small little hairline, little line over the implant, and that's how they usually diagnose a rupture. But you rarely see that the silicone come out of the breast shell. The incision for breast implants are usually placed along the inframemory fold. There's a few different ways, and it's really up to your surgeon to decide on what's the best incision for you. Other incisions are around the areola, the inferior aspect of the border of the areola. That scar hides pretty well also, and along the armpit area. But for a lot of surgeons, it's very difficult to place a silicone implant through the armpit incision. The areola incision, because you have to cut through the breast tissue to get underneath the muscle, there's a little bit of a higher risk of a capsule. No one knows what causes a capsular contracture, but some of the research points to maybe a subclinical infection or maybe some blood, any type of inflammation to clear out blood or to fight some infection leads to a thicker capsule, which becomes a hard implant. And so when I say subclinical infection, there may be some seeding of your breast ducts, because everything in your skin, you have billions of bacteria, but below your skin should be sterile. And one of the areas that it's not is your breast ducts. Your breast ducts are lined with bacteria. So when you're cutting through breast tissue through the areola incision, you're cutting through breast ducts. So that implant comes into contact with that. So theoretically, some seeding of that bacteria, it's not enough to cause pus, fevers. It's just enough to cause that capsule to thicken. And that gives you a little bit of a higher risk. I personally think the best plane and incision to place implants is along the inframemory fold, the breast fold. The scar might be about 1.5 inches or so, sometimes longer, depending on the size of the implant. But we go right below the breast tissue and right below the muscle. So that's why there's less risk of contractures and complications. Other complications, we talked about rippling. That's when the implant, you see some visible rippling, like kind of wrinkling of skin, usually in thin patients. And the risk is higher when you place implants above the muscle and the tissue is very thin. So if someone's wanting implants above the muscle, which we don't really do that frequently, you have to make sure they have at least a centimeter and a half of breast tissue so it can help mask some of the rippling that can occur. And that's why we like to put implants below the muscle, less risk of contractures, also less risk of rippling. One of the things that we correct on other patients that we didn't primarily operate on is something called malposition. And that's when the implants drop. They fall out of their pockets. That can happen with weight loss, weight gain over time. But that's when these implants that are round and smooth that we choose usually move. They move about an inch up and down, side to side. And when you lay down in bed, it moves like what your breast tissue does. It goes to the side a little. But what if it goes a little bit too much to the side? Or if it falls too low? That is an implant malposition. And so when we see patients with malpositions, there's a few things that we can do to treat that. And the first thing is just we have to close the pocket out laterally and inferiorly and make sure that implant stays medial. You can also use a skin substitute, like a hammock they call it, or an internal bra that we suture on the inside. There's no big scars. It's the same scars that we use for breast implants, but we place a sheet or mesh, kind of like a hammock, at the bottom, medial, and lateral aspect of the implants. So we kind of suture it to the ribs, and then that implant should stay within that area and not move too much. So there's ways to treat malpositions. But I always tell our patients, if we're correcting a malposition, there's a 50% chance it can recur. So we tell our patients to always wear for the first 3 months a bra. It's like the opposite of breast implants. When you first get an implant, you want to massage because they're really high and they don't move. So you want to massage them, and it takes about 3 to 6 months for final results where they drop, the skin stretches out, the muscle is stretched, and the implants are moving very easily. They move about an inch. Normally up, down, side to side. So we talk about malpositions that they drop a little bit too much. And so with malposition repair, we don't really want to massage too much. You want to wear like a bra at all times, especially with good support along the breast fold, so that implant can stay and heal in that, so it doesn't move. It just kind of gets scarred in at that position. It will still move an inch side to side, up and down, but it's not going to, at least using that bra for the first 3 months, giving support, helps a lot with it migrating too low. Because what if you're sleeping without a bra and they move in a certain position, you're putting a lot of pressure on, and then you hear a pop or a pain, and those sutures that we use end up popping, and the implant goes right back. And that's why there's a 50% recurrence with malpositions. But if you adhere to your surgeon's instructions, then we can minimize any risk of any complications that can occur. There's something very rare that they found with textured implants. It's a rare form of cancer that they found with breast textured implants. And they found, like, years later with textured implants, or sometimes even less than a few years, patients would start to swell on one side. It was filled with fluid. I mean, we're talking about, things that are not natural, like it's, 50% bigger and it feels like a fluid pocket. When, I've never seen this, and we do a lot of breast augmentations. It's a little rare. But when they removed the implant and they sent the fluid for cytology, they found like a T cell type lymphoma, like these cells that were floating in this fluid look cancerous, or is cancerous. And it's weird, but the treatment is to remove the capsule, the fluid, and the implant, and to replace them with non-textured implants. So they've only found this in people that use textured implants. So in America, we use a lot of round, smooth ones, and that's all I use. I've only used textured implants on maybe 5 patients, and that's because they requested it. But yeah, I think, to me, a textured implant doesn't move. It just gets stuck, and it doesn't feel natural, and it feels very hard. So I think, for me, I've always preferred the round, smooth implants because they feel more natural, they're softer, and they move like natural breast tissue does. In conclusion, breast implants is very safe to do. It makes patients very happy and very confident, and always select a board certified plastic surgeon for your consultation and for your surgery. That wraps up our podcast. Hope you learned a lot about breast augmentation implants. Thank you for listening. You can follow us on social media also. And if you're interested in a consultation, you can call our number at 972-378-3870. And you can also request a consult at our website at drplano.com. And don't forget our holiday specials that are good until the end of the year. Take care.